Good afternoon. This is Matthew Morrow, and this is my Week 1 presentation entitled Splitting Schizohairs. Today, I will address 3 topics regarding schizophrenia and related disorders. First, I will discuss the key factors that define psychotic disorders. Then I will look at the differences between schizophrenia, schizoaffective disorder, and schizophreniform disorder. Finally, I will talk about why it is important to have specifiers and modifiers present in listing the diagnosis. So there are 5 key factors whenever it comes to diagnosing psychotic disorders. So the first of these is delusions. So if a person has beliefs that they're not going to change regardless of whether there's evidence that shows them that that belief is incorrect or not. So it's incongruous with reality. They believe something that's just not true. For instance, they may have a belief that they're a special agent with the FBI. You call the FBI, like, that person doesn't work for us, we've had no contact with them, but they believe it. And so they're acting in light of those delusional beliefs. The second is hallucinations. So hallucination is whenever they perceive something even though there's not a stimulus. So they're either seeing it, smelling it, hearing it, even though it doesn't exist. So the most common of these are auditory illusions. So they'll hear voices, for instance, telling them things that the voice doesn't exist in the real world, but they are perceiving it in their brain. An example, I've seen a young female, she was having visual hallucinations. I was talking to her and she's looking off into the distance, and I could see that she's looking at something in the sky. I asked her, "What are you looking at?" And she's like, "Demons." She could see demons flying around in the sky. So obviously I looked in the sky, there's no demons there, but she perceived it. They were real to her. So those are hallucinations. The difference between hallucinations and delusions is just the belief that's not really true, and then hallucination is the actual perception of something that's not there. The third key factor is disorganized speech. So a lot of times they'll switch from one topic to another, or if you ask them a question, they kind of answer it, but only somewhat related to what you asked. So their speech is really disorganized. It makes it really difficult to follow them in conversation. The fourth key factor is abnormal motor behavior. So this can be staring off into space or staying in the same position for an extended period of time, being really rigid. Maybe they look like they have a neck brace on even though they don't. And finally, the fifth key factor is negative symptoms. So the DSM-5 describes that as diminished emotional expression and avolition. So a lot of times you'll hear that they have a flat affect. So you can't really read emotion in their face. They don't really seem to express emotion whenever you're talking to them. It's important to note that negative symptoms will have a big effect on the quality of life. And we'll start off by comparing schizophrenia and schizophreniform disorder. So in schizophrenia, in order for a diagnosis to be made, they have to have at least 2 of the 5 key features of psychotic disorders that we talked about, one of which either need to be hallucinations, delusions, or disorganized speech. These symptoms must be present for at least a month, and then they persist for longer than 6 months. So this is a long-term disorder. Occupational and social functioning is significantly impaired whenever it comes to schizophrenia, and that's required for the diagnosis. Schizophreniform disorder, similar to schizophrenia, it's got to have at least 2 of the 5 key features, present for at least a month, but the difference is that it lasts no longer than 6 months. So if it goes longer than 6 months, it's schizophrenia. If not, then it's schizophreniform disorder. People with schizophreniform disorder are more likely to have better functional outcomes than people with schizophrenia, and that's because it's not a persistent disorder at that point. It's a short term, no longer than 6 months. And about a third of people with schizophreniform disorder recover. The other 2/3 either go on to be diagnosed with schizophrenia or schizoaffective disorder. So that just means their initial diagnosis was schizophreniform, but they're diagnosed before the 6 months. After the 6 months and the symptoms still present, then obviously they change the diagnosis to schizophrenia or schizoaffective. So now we'll talk about schizoaffective disorder. Schizoaffective disorder can be thought of as schizophrenia plus mood disorder added to it. So there's some nuances to this. Is mood disorders can cause episodes of psychosis, so it's important to differentiate between the two. As you can see, in schizoaffective disorder, they have at least 2 of the 5 key features that we talked about. And at the same time, they show symptoms of a major mood disorder. The way you can tell that it's schizoaffective and not the mood disorder with psychosis is that the hallucinations or delusions will occur in the absence of the mood disorder. So as they come down from the mania, the hallucinations or delusions are still there, or still present. The other thing that you need is that the symptoms of the mood disorder need to be present for the majority of the duration of the schizophrenia symptoms. So if they've been diagnosed with schizophrenia, they've been having auditory hallucinations for 2 years, then they need at least a year of symptoms of one of these mood disorders in order for it to be diagnosed as schizoaffective disorder. So why is it important that we have specifiers and modifiers listed with these diagnoses? For starters, I think it's important to understand the negative effects of these disorders. For instance, schizophrenia, people with schizophrenia, they're much less likely to be married, they're much less likely to have completed college or hold down a job. They're more likely to live in poverty, to be homeless, or to attempt suicide. People with schizophrenia have a life expectancy of 14 years less than people without the disorder. So it's important to understand that there's really severe consequences that come along with these disorders. The disorders are heterogeneous, so that means that they will vary greatly between individuals. So disorders are really complex, and there's a lot of factors to consider whenever making a diagnosis in these. In order for us to have an accurate prognosis and to effectively treat it, we need to know these things, all the different factors that might be influencing the disorder. That's why there's differences between drug-induced, or why we want to make a distinction between schizoaffective and schizophrenia. We need to understand, how long's the schizophrenic symptoms been there compared to how long have the mood disorder symptoms been there. So all these are important distinctions that need to be made for the good of the patient. Okay, thank you for watching. Here is a list of the references I used for this presentation. Thank you.